So today I have Miss Christy Ball and Miss Rina Gonzalez, who are dear friends and colleagues that I socialize with, that I know personally, but that I respect professionally. And so these two women, whenever somebody comes in and I know that the kids are needing some help, I will always refer these two women. Um, Christy, if you can give us a little bit of background about yourself so that people know who you are, and I'm sure people already know who you are, but just to give them a little background about yourself,
Okay.
please.
Yes. I am an OPC by license, so I'm a psychotherapist in private practice here in McAllen. And I've lived here my whole life almost, but I'm originally from Argentina. So I am bilingual. I love working and living here. I love the Valley. I feel like a transplant that did well and stayed. So I went to UT, studied philosophy for an undergrad, and then my master's is in clinical psychology.
And LPC, can you tell us what that means?
Licensed professional counselor. It's a type of license here in Texas that allows us to diagnose and treat mental health conditions.
And how is that different from a psychiatrist or psychologist? Like, how is it that they come to you and not to one of those other two type of people?
Well, a psychologist does psychotherapy like an LPC, but it's a PhD license.
Got it.
A PhD degree.
Got it.
So you have to have a PhD to be a psychologist. And they do more assessments.
Okay.
We also do assessments, but they specialize in assessments.
Okay.
A psychiatrist is an MD and they are prescribers.
Got it.
So we work with psychiatrists. The standard of care for moderate to severe mental health conditions like anxiety and depression, it requires medication. So I work closely with psychiatrists and also with family doctors and OBGYNs. So that's the collaborative care that we use. So we call them people like Carmen Solis also. They're prescribers that we can get our clients into so that they can get the standard of care and get the medication they need as they're getting their therapy.
Is it your experience that it's easier to get in with your family doctor than your psychiatrist for medications?
Yes, and for medication management that's just common, like SSRI for anxiety, depression, they manage it really well. They're easier to get in
Good.
with, and they're probably better than a psychiatrist because a psychiatrist is a specialty that has a 3 to 4 month wait list. So a family doctor can just see you next week, right? And then they know your family history. They know who you are. They probably already manage your hypertension, your diabetes. They just add on. And family doctors, they prescribe like 70 or 80% of all SSRIs in the country. So they're experts. They know how to do it. Unless they're super old doctors, like the doctors in the last 30 years, they know how to manage.
Good.
Yeah.
And that was why it's a concern for me, because I'll have people say, well, I'm making it up. We only have like 4 psychiatrists and I can't get in, and I've been calling and it's like May before I can get in. I tell them, go to your OBGYN
OBGYN and family
doctor.
Yes.
Okay, good. So you agree with that?
100%.
Just making sure.
Absolutely. And then the other issue, back to you, is when people are considering getting on medication, if there's legal issues with the divorce, they worry about it. They think, oh my God, what are they going to say? But from my perspective, I don't know what a judge thinks, but you can tell me, like, what do you think they would say if someone's on medication? It's better to be medicated than to be not controlled, right?
Exactly what I say. Like, if you know there's a problem and you're not doing something about it now, could you potentially be the problem to those around you?
Right.
Versus you're doing something about it, and I don't.
And they're also protected records. Yeah. They're double protected. So that also.
And not only that, I think the stigma behind taking medications, I mean, you take it. I mean, I would think at least, 50% of the people I know have at some point in their lives, encountered anxiety or depression that it requires a counselor or medication.
Yeah.
But there is a huge stigma,
Huge.
especially the Hispanic culture.
Honey.
100%.
It's difficult at times. I'm sorry.
Yeah.
No.
It is.
Rina, introduce yourself for us, please.
My name is Rina Gonzalez. I am also an LPC, licensed here in the state of Texas. I was a school teacher, then I was a school counselor, and then I went back and got my licensure. So I'd like to say I work with children because I've been around children my whole life. My husband and I have been married 25 years. We have 4 children. And when I'm not working, I am a mom 24/7. And we're at the ranch. But I enjoy it. I'm born and raised here in McAllen, born in Far, raised here. So I'm also bilingual. But yes, I love working with children.
Thank you.
And that I had a forte, I would say that's what it is. Or young adults, children and young adults, because I've been around them my whole life. And I have 4 kids, so I have plenty of experience.
And that was one of the big reasons. So you all are downplaying, I think, how important you all are in our community. I think you all are immensely sought after by people that are needing the help, both of you. And I also know that on a personal level, both of you are very level-headed. There's very little things that, rile you all up and, oh my God, how dare you? You're not judgmental. I feel like I can share, like if I had something on my body, but oh my God, Rina, look at this. And Christy, like this and that. Like,
Well, I think that's baked into the job. Like, people
hate-
think all the time that you're going to shock us. But you're not going to shock me. I've been doing this. You can tell me anything. You bring up a kink. I'm like, okay, all right, that's your kink. You're not going to kink shame you. It's okay. As long as it's consensual, nobody's getting hurt,
and that's what I love.
unless there's a safety word or whatever.
No, because there are other counselors. I know quite a few counselors, and it's like, well, maybe you shouldn't be doing that. And like, but I already did it. Like,
No, that is someone that is not following our ethical guidelines.
I
We're
agree.
not supposed to
We're
be
not
directive.
here to judge, and we're not here to judge.
We're not
here
supposed to
help.
be directive.
Oh.
We're not supposed to be saying like, "Hey, you need to do this." No, that would be taking the person's autonomy away.
Exactly.
And if not, I would be a priest. I'd be like, "No, I'm not a priest. I'm a counselor."
good. I love to hear
Yeah.
it. So one of the big things that's been coming up, and it came up recently on school board about this lawsuit that's happening with big tech and school
Oh, yeah.
districts. about
So
social media.
interesting.
Yes. So how much influence
interesting.
do you all see with social media and the kids you all do are over the age of 12, right? So
And mental health
and mental health. Yes. Like
It's crazy. It's a phenomenal that just keeps getting worse and worse and worse. The society, the pressure that social media is putting on our children right now and our young adults, it's almost completely out of control. The pressure and anxiety, I mean, that's almost what I see. 80% or 90% of my clientele is pressure of looking a certain way and acting a certain way and dressing a certain way and hanging out with certain kind of people. And it all goes back to social media, and everything's on social media. I mean, it's like they can't have a meal without taking a picture and sending it out. They can't, brush their hair without showing everybody how they're doing, or they can't wear their makeup, their outfits and their how-to. It's just blown up. And I myself have to go onto social media just to get all this lingo in. These kids come in and teach me stuff every day. I'm like, what does that mean? So there I am researching on social media or asking my kids, because it's really, completely gotten out of control. At least in my practice and what I'm seeing with stress and anxiety.
and what about the flip side? Like the people that are the bullies on social media.
Ugh.
Like I see that a lot, but every once in a while I'll come across someone that the kid will be the bully on social media, and the kid ends up saying, well, I mean, that's what I saw so-and-so do and so-and-so do. And I'm thinking, so you repeat that and not the good that you've seen. Like, is that a mental health issue? Is that a parenting issue? How do y'all deal whenever it's a bully on social media?
If they're being a bully
Yes.
or if they're bullying.
If they're bullying.
Well, I mean, they're not being any different than they probably are in person, but it gives us privacy or protection, right?
Like a paper dragon.
Yeah,
We
we're
call
gonna
that
be
the law. Yes. You're a
worse.
paper dragon.
Yeah, you're gonna be absolutely meaner. People are trolls and whatever. They say horrible things that they wouldn't say in person, right? So, yeah.
But I also think that the parents really should put like a tighter ring on stuff going on. I'm a firm believer, especially with the little ones that get their phones. I mean, I have a 6-year-old that I'm seeing who has a phone. So it just, one of my clients. And so when does it stop? And so I had a client who was very upset and just had it outright, cry an attack because her mom took her phone away at 9 years old.
Oh, yeah.
And I'm
Yeah.
like, oh, I'm sorry.
End of
Like
the
she
world.
should have taken, you
Yeah.
take your kid's phone. Don't ever be ashamed to take your child's phone away and go through it. I tell my parents all the time, take your kid's phone and go through it. You'd be shocked to see what you have.
For sure.
I tell my own kids when they're of age and they get their phone, my husband has them sign a little contract and tell them, I paid for this phone. This is my phone. I am allowing you to use it. And these are the rules you have to follow. And in the beginning, they have to turn it in every night. And it charges in our room. And they know at some point we may go through it and stuff like that.
So
and
what I
like
find,
they don't like it.
I'm sorry to interrupt, but what I find is that kids have burner phones.
Yes.
All of my clients at least, they think that, they're
Either
getting the phone
phone
put up.
phones or they get like a landline.
No, they have
How
like
did
the
you
old
never get a
iPad. They're
landline?
still on there.
Ads.
Or the gaming system.
Yeah,
could
yeah,
you
yeah.
communicate on
Yeah.
gaming
So
system.
as far
They're
as
smarter than we are.
as
They're
far as
smarter
social
than we
media
are.
is concerned, you can't expect the kid. It's like telling a crackhead, "Here's some crack, put it in your pocket. You can't use it."
Exactly.
Or there's crack in that room and you can't use it. They're going to figure out a way to get high, right? Social media is designed to just engage and numb. And that lawsuit, it's so interesting. I actually saw
You saw the
a
petition.
sample and I was just randomly open a page.
Yes.
And they were talking about engagement algorithms,
Mhm.
how they promote the
It was all intentional.
yeah, they promote the high risk behaviors, the challenges like the Tide Pod or things like that.
Yep.
They're actually promoting the use, right? And rewarding, right? So the more you do it, the more you see it, the more you continue. And it's to the detriment of the kid,
Sure.
Um,
For sure.
but yeah, they're just hooked on it, and we have to do our best to put in guardrails, but we're setting them up for failure, I think, if it's just there and around. And I'm not proposing for them to have it just taken away or not have social media.
Of course.
But the
No,
management and the safety mechanisms, the guardrails have to be there from the companies. And I think that's what that litigation is going to go to.
Yeah, that's what it.
If you look up depression or mental health, you get all kinds of content. And some of it is, promoting, suicidality, suicidal behaviors. And those are the filters that aren't there.
Speaking of social media, you just prompted. A couple of years ago, this is when I thought I don't need to be on social media as much as I am. I know
Yeah.
that I'm on it much, but
Yeah.
I there'd be like 20 minutes at the end of the day or in the morning that I'd go through it, and now I've kind of stopped.
Yeah.
And the reason was this one case. Young man was going through a divorce. He committed suicide on Facebook
Yeah.
Mm-hmm.
and posted his suicide note on Facebook.
Yeah.
Put the camera live, and
And you saw that, or you
and you saw it all. Yeah.
Yeah.
And I'm thinking, like, I know there's a mental health issue, obviously, but the fact that he wants to put this on social
Yeah.
media instead of
Doing in
calling
private.
out to your family or calling out to somebody,
Yeah.
help me. It's like, this is my community, and they're all just watching. They're not like
right.
calling the police. It was just so disturbing to me. But I don't think the kids recognize. And then not only that, a lot of them, my 8-year-old will say, "Oh, Mama, that's fake."
Yeah.
Well, then why are we watching it? Like, if it's
Yeah.
fake,
Yeah.
like,
Yeah.
why do we? I don't.
Right.
I don't get the
But
logistics.
the algorithm creates the reality. So there's litigation that started and changed laws in England. And this was a few years ago, and it was a 14-year-old that committed suicide. And she was very high achieving, a really top girl. And the parents had no idea that she had been struggling, and on Instagram was looking up, and the algorithm had reinforced a very dark view. So how can, with the
It's hard for
parents,
her to get out of it.
right? That's what she saw, and and she, committed suicide. The parents didn't know because she had this very outwardly,
Perfect lifestyle.
yeah, and she hadn't disclosed that she was struggling with these thoughts, and she was impulsive, as teenagers are. So I think that we are probably 10 years behind, but I think that we're going that way. Another safety that we need to put in for kids, I think, are phone-free schools
Yeah.
and areas. Just like you can't smoke in certain areas, I think that's coming. And it's already happening in the Northeast and more progressive areas.
Yeah.
And
And you
I
hear parents argue against it, saying, "Yeah, but what about if something happens at school?
Exactly.
I want to get in touch with my kids." And I can see that as balancing
Yeah.
out, but there's got to be something where
Yeah.
the kid doesn't, like you're saying, they don't need the crack in their foot in their pocket, like.
And you have to tell them, you be stronger than the crack addiction. Like, oh, good luck. Good luck with
Right.
that.
Right.
Yeah, it just
Yeah.
So most schools, at least in schools my kids are at, they as they walk into the classroom, they have to put it in the pocket, and they are not allowed to have the phone with them the entire time they're in class.
I think there's mixed
So-
but there's
compliance
some
there.
are there.
So that's there. So that's their way.
Okay.
But when the bell rings, they grab it from the pocket
Instantly.
and right. They're going down the halls, bumping
Yeah.
people because they're on their phone trying to catch up on when they missed it.
Yeah.
So no, I completely agree. There's got to be some kind of standard, and I'm.
But it has to be foundational, like
It
built
has
into it.
And it has to start from the bottom up.
Yeah.
It has
Because
to.
it's not fair to us as parents or to the kids. It has to come from them. And I think it will. They're going to have their reckoning, I think.
Okay.
Yeah.
We talked a little bit about medicines, and you said SSRIs. Is it something that within certain socioeconomic groups that people have the stigma, I don't want to take medicine, or is it across the board? Is it all cultures? What do you all see without generalizing? Because in my practice, I see it whether you're, bottom of the pit poor, whether you're tip top rich, wherever you land, there's mostly a stigma against medications. Do you all see that?
I see there's a stigma with mental health.
Okay.
I have clients, and I have friends who are doctors and lawyers who are from Argentina, who are from Colombia, and they are huge proponents of mental health. I just think some nations are much more advanced in that line of thinking. I'm not saying the United States is not, but it's harder. And I've had this discussion with a couple of friends, and they're the first ones to send their kids to me because they know, because they said back home, mental health is so important. Like 80% of the people, back home are all seeing counselors. And here we come down here. So I'm not sure if it's a social economic issue, if it is a cultural issue. Many times, the Hispanic people, they're very prideful and they don't want to, they're used to keeping stuff inside and more internal, and they're not used to expressing their feelings. And I'm not saying that's at all. A lot of people can handle that. Some people cannot. Obviously, I'm a proponent of mental health, and I think it's very important. But yeah, I just think that we, in this general area, I have clients I see on Zoom from Houston and Florida, and they also have no issues. Like one takes breaks from her work, and the
Make it a priority.
They have no issue. Her boss has no issue of her doing a Zoom with me. So I just think it may be the general area. However, having said that, I really think it's gotten a lot better. Like I'm getting many more calls than I have in the past of mothers or fathers or families just in general trying to send me. I see young adults mostly. I do see adults as well, but I see young adults, and they're searching for help for their children. And I think all of this has to do with what we're talking about. The issue with medication, the issue of social media, and the pressure of everything going on around us. So I don't know. I don't know if I even answered your question, but I do think we're a little behind to where the stigma, it's bad. You're seeing a lawyer, you're seeing a counselor, like, why? What's wrong with you? And then I have a friend call and say, oh my God, like one of my dear best friends called me, my comadre, and she said, okay, well, I'm shocked because my daughter was at a party with all of these 22-year-olds and your name came up like 4 times. And she said, they're passing your card around because they think they're sending everybody. So obviously those clients do not have an issue telling people they are going to counseling, and they feel good about it. So they want to share that with other people. And I mean, ideally that's what we want. We want people to know that we're here to help. And, and there's help for you without feeling embarrassed or saying, oh my God, I can't do it. But I can understand.
I think you
understand
are in the
both
same dilemma that I am in terms of marketing and advertising. It's horrible. I haven't done it. And those that can do it, God bless you. But I don't know how to. Like 25 years of practice and the fact of going out there and saying, I'm a divorce lawyer, hire me. Like,
but you don't have to. But you don't have to. Your name is,
But that's the point is I'd rather do it like this. Like we're educating, not necessarily come hire me, come hire me.
Yeah.
But in terms of you all too, like imagine you all going out there and advertising and saying, let me help you get through this, or
Yeah.
I can do this. I mean, how do people know to come to you except, word of mouth?
Lawyers, like, people don't want to go see a lawyer. They go see a lawyer when, their marriage is breaking down, right? And they come to see a counselor when things are happening, right? But as far as stigma is concerned, I would break it down pre-pandemic and post-pandemic. Stigma has gone way down post-pandemic, especially for the younger people. Younger generations are more open. They even use it as a flex. Like my therapist said, they triangulate with the therapist. So it's definitely changing. It's changed. But I mean, are we totally there where people are, not ashamed that they're struggling? No. I think that regionally in this ethnic enclave that we live in, there is more stigma, and it's more, maybe it's related to religion, you go to the priest, it's insular, you go to your family, and also within the Hispanic, I'm Hispanic too, way south, right? But still, it's, why are you crying?
Yeah.
What's wrong? Right? Like,
it's true.
So how many of us grew up hearing that? Like, what's wrong? Why are you crying? It's not supportive. It's just like, stop, come on. And we have a lot of people that are first, second generation, and we have way more important things to do when you're an immigrant.
Yeah.
You are acclimating, you are integrating, you're in survival mode. So why are you crying makes
Very
sense.
true.
It's like, suck it up. We have shit.
Suck it up, buttercup. We don't have to.
But now those kids that had grandma maybe was, an immigrant. So in my family, my grandparents immigrated from Europe to Argentina to here. So we have the same essentially experience, and there's a lot of adjustment stress that goes with that, with moving. There's relocation trauma, and you have to figure it out. And that doesn't mean that you don't have the stress, but it just depends on how you respond to it.
And that's the other thing I've seen, I think since COVID, now that you say pre and post, a lot that I've seen since COVID is parents say, oh, you're having an adjustment issue, or you can't, the divorce is hard for you, or, the bullying, whatever, and they homeschool. And I'm thinking, okay, that might not always be.
Yeah.
I'm not, a counselor in any way, shape,
no, that's avoiding.
Shouldn't we have them with kids, or
we
try something else? But I've seen the homeschools, the population
has
so much
grown
since COVID.
Well, because we have virtual options now. It's way easier to do Zoom and all that. So it's become a little bit more accessible, I think. Yeah.
But even parents that have full-time jobs are doing the homeschool because there's problems at school, and it just, I love the idea of being able to do it, but I just don't know that works for every type of child. Like, is that always the solution?
Yeah, it won't work for
I think it just depends on
it just
each
depends on the child.
Yeah.
Oh.
It just depends on the child.
Self-harming and girls. Do you all see it more in girls or in boys?
Yes.
Okay, explain
Was
that.
that fasting us?
I've heard that so much, but I don't explain the why. And how does a parent find it or pick up on it?
Okay. Well,
because they won't share with you.
They do not share with you. A lot of times, in my case, what I have seen is for girls, I've only had one client that was a boy, and I've had several that are females. They start with cutting.
Cutting in obvious places,
or about to say, it's
hide
extremely rare that if they're cutting in obvious places, that is an outcry. That is, they want the parent to know there's something going on. If someone has cutting on their wrist and say, here, that's an outcry. That's like, please help me. Not to say when it's not an obvious place, it's not outcry, but it makes it very difficult. Inner thigh is a huge one. Behind the knees, down here on the arms. Those are areas. Behind the knees, I've seen it.
Yeah.
The inner thigh and back here are the larger ones. Down here, under the breast area is another area. So in many cases, in my experience, they hide it, and it is a friend who sees it. Either when they're in the locker room, or when they're in the bedroom changing, or she is hurting, or she is bleeding and she needs someone to help her put the Band-Aid on. And it is the friend who goes and tells an adult, the mother, the teacher, the counselor.
Not the
And
child.
it is, it's for the child, and it does obviously happen. There, for the child to go to a person, normally they go either because they're scared and it's out of control, or because they know somebody has already seen it and they feel, okay, I better go say something. I'm about to get outed. Let me go do something about it. So they're trying to get a step ahead. But it is definitely a situation happening all over the United States, all over everywhere. And everybody does it for a different reason. I wish I could say, oh my gosh, because they're stressed out about something, or they're, in their mind, and this is what comes with cutting, in their mind, they want to feel that physical pain because it takes the mental pain away.
And does it truly? Like, is there science behind that? No, it does. It's just how they feel.
It's a numbing behavior. Okay, so if you think when stressful things are happening and you have an exit, if you do this right here, then you won't think about whatever else is happening. A lot of the times it's poor distress tolerance. They're having a fight with mom. Mom's not listening. So they go and they release.
And there it is.
Yeah.
Okay.
So, but that sort of like numbing behavior, if you can think of it as a big bucket of suicidal ideation.
Yeah.
If you're so stressed, hopeless, it's never going to get better, you start thinking about suicide, right?
And at what age is this common at?
Mental like anxiety, depression,
The
typical
self-harming
onset, it's like 12.
12.
I was going to say
But-
self-harming, you start seeing it like at 12 or 13.
12 or 13, but then access to care, it's like 5, 7, 8, 9, 10 years later. So they start at 12, but they don't get help until college a lot of times. That's very large, like old school. Like I don't know if it's changed now after the pandemic, but when I was in school, that was the lag. But that numbing basket also has shopping, social media, drugs, alcohol, anything that just kind of like dampens.
Like a distraction.
Yeah. And I would categorize. So I know it sounds like, what the hell? Why are they doing that? But if you can relate it to some of those others that maybe you could understand,
The shopping.
that's their version.
Yeah.
Does that make sense?
It does.
Yeah.
And so then if you're a parent going through a divorce or about to get a divorce and you're kicking yourself thinking, I don't want to get divorced. I can't leave my husband because it's going to mess up the kids even more. And they're going to self-harm. And then you find that they're self-harming. I feel like women, men too, but more women tend to carry that guilt of, I'm going to destroy my family and then my child's going to be doing worse.
But where does that come from? That if you divorce, is it social, religious? Did you hear from mom? You know, where? Seriously.
Yeah.
Or
is it a codependency that you have with your spouse?
Right.
Like
that you think like, no, I have to stay in an unhappy marriage. And if I leave, it's my fault. Yeah.
No,
do I need to be?
I had one where, a couple, but the one I remember recently, young boy, 17 years old, left a suicide note for mommy and says, maybe this way my daddy will be sad and won't hit you anymore. And he had been telling, this was probably like 22, during COVID, like the abuse just got really bad, the physical abuse at home. And he kept telling
nobody was ready to have everybody together and under one roof and four walls. Nobody was prepared for that because it doesn't happen. Yeah. For 24/7, everybody's together. And so, a lot of stress came from that.
Yeah.
And even like you're in a dysfunctional relationship with interpersonal,
it's gonna,
where do you go?
Intimate partner violence. I mean, that's going to make it worse. So, yeah.
And so, the little boy says, maybe this way, it won't happen. And she came in here.
Yeah.
She waited 2 years after the suicide to come in and say.
After the note.
Okay. This is why I'm here. And
so she was so concerned. Yeah, absolutely.
And it's like.
Because she believed that if she left.
Yes.
This could happen.
Yeah, exactly.
And I don't think people recognize staying in a bad marriage is just as harmful to the kids because a lot of mommies and daddies, they have a hard time and they get through it.
Yeah.
In a 30-year marriage, a 20, you're going to have some issues.
Yeah.
But mommy and daddy work through it. And then the next day, the kids see, oh, mommy and daddy are fine now.
Yeah.
But they just remember mommy and daddy were fighting last night. They didn't see mommy and daddy get good again.
Yeah.
And how, what coping skills they use.
It's coping skills.
It's very confusing for a kid.
Of
Very
course.
confusing to a child.
Yes.
Yeah. The uncertainty, they never know what they're going to get. So what does that do to the nervous system? Hypervigilant, fired up.
And then it triggers.
Yeah.
And their behavior just escalates from there.
Yeah.
And do children that are depressed or have anxiety, this is another one that I don't know if it's true, they don't have a circle of friends.
I mean,
Like, I don't want to believe that.
isolation is one of the behaviors that goes with depression.
It's one of the
And
causes.
sometimes with anxiety too, if they have social features to their anxiety, but not always. Like if you're a socially anxious kid, you're going to withdraw and not see people. But with depression, yeah, isolation is one of the things that happens.
And you see that, like when you talked about earlier about how we go out there and advertise.
Yeah.
So I do not.
Yeah.
My practice is strictly referral basis. But so I don't go out and do presentations. Friends do, and they're phenomenal at it. But I'm on campus a lot with PTO and other things, and I will have teachers come and say, "Look, I'm seeing something. I'm a little bit concerned," and it's almost the first thing is the withdrawal. That child who is always outgoing and talking and playing and is suddenly just withdrawing themselves. And so that is a red flag for this teacher, and it should be for the parent or
That's what I'm
friends.
trying to get. Like, what
Or
should a parents
friends.
look out for?
Yes.
Like,
When you
okay,
see
we're having
someone
some issues.
isolating yourself or not hanging out with their friends or like staying in their room longer than usual or even the appetite when they don't have an appetite and they're not eating, those are all little factors. And then again, they're adolescents and, our kids have hormones and they're going like this 24/7. So it's hard for
It's hard to know what's
parents
normal.
to
Exactly.
know
That's why I'm asking,
because
like, as
what
a parent,
is, what is the norm?
Yeah.
Like I had a mother call me, my daughter's out of control, and I talked to the child and, talking to her, okay, this is a normal 15-year-old.
That's the other,
Like,
the other side.
give her a break. Everything she is doing is okay.
Yeah.
But for the mom, she's like, oh my gosh, she's talking back. She's yelling. She's not doing her homework.
This isn't the kid I knew.
yes, I hear that a
What's
lot.
happening?
Kids are supposed to change.
She was never like that. Well, mom, this is growing up. This
Yeah.
is adolescence. This is a hormone. Their bodies are changing. Everything. I always say, think of how scary it is for a child sometimes, male or female, when their own body is changing, not just physically, but mentally, your thoughts are changing and your, how you process is changing. And, so a lot of kids don't like it. When young little girls start, their breasts start growing, it freaks them out a lot of times,
Or like when they're little, we know the books, like you have a growth spurt at 6 months and at 18 months.
Yeah.
And a lot of people don't recognize.
Of the past.
hair growing where so we just everybody has to take a step back and understand that this truly is nature and this is normal. And hormones are crazy. Hormones are just they go on to different factors, but it's hard sometimes. It's hard to just say, okay, she's going through something, or this is normal, it's hormonal. So, you just got to pick and choose and try to figure your way through it.
And I think when you have a
tough.
concern, if its behaviors are a little bit more extreme, there are more drastic changes, go to your pediatrician. They know how to diagnose and manage.
But I've been in
they
that
have
situation, and the kid's with me, and she's like, "You're such a drama queen."
Yeah.
Oh my God, everybody's like this, and now you're the crazy mommy,
Yeah.
for taking the child, and it's like,
Yeah.
no, everything's
know
okay.
what?
Like,
These-
I'd rather be safe.
A
than-
good pediatrician will at least use a standardized screener,
That's exactly how.
and you'll have a
Is
baseline. Okay,
that
so
that
maybe
depression sheet that
like
they
or a
send out?
GAD.
Okay.
GAD
Right,
is like
GAD.
7 questions, or the PHQ-9 9 questions, and at least someone will check. One of the items on the PHQ-9 is, are you having thoughts of hurting yourself? Right? So at least someone will ask.
And do kids answer that truthfully?
Well, with confidentiality firmly in place, they should be able to.
Okay.
Yeah.
Okay.
So I let my clients know,
Because
you can talk about it. This is something that happens with depression. If you're thinking about it, you have plan intent, your contact people will be brought in and will help you stay safe. right? But just because you're thinking about it, right? The numbing bucket engaged, right? And you're thinking about it and you're on a loop, but you don't have a plan or intent, no one needs to know. You're not going to be
Yeah,
calling
that's what
911.
we're here for.
You're not
We're
calling.
here to help you through that.
Yeah, and there's a
Figure it
way
out.
to manage. There's a way to manage.
it.
Just because you're thinking it doesn't mean you want to do it, right? And so that's that differentiation. So with really firm confidentiality in place, we're going to work through it. So
brings
yes,
me
they
to-
do answer.
To
They
my
do.
last point about how you, at the beginning you mentioned it about how people think taking a medication is somehow going to be bad for them,
Yeah.
or admitting that they have a problem.
Yeah.
It's hard to get. I've had plenty of people say, I'll ask them, what medications are you on? None. But you can tell there's something off, and maybe they're depressed. Like, you can just feel the energy. I mean,
Yeah.
I can't diagnose someone, but you feel the
You can
energy.
tell. Yeah.
Yes. Or they're like nervous, something. And they'll come out at some point in the conversation and say, well, I was diagnosed bipolar back in 2015.
Yeah.
Okay, well, what medication did you take? I don't remember, but I stopped it because everything was fine.
Yeah.
Does that diagnosis go away? Do you
Yeah.
come back to it? And so those are always
a
my
really good
questions, like
question.
just asking that.
Yeah.
Like, what do you do with it?
Yeah.
Like, to educate me. And then people will say, well, maybe I've been feeling a little bit of it, but they don't want to share because they're afraid that the spouse is going to use it.
Right.
in
Weaponize
divorce.
it.
Yes.
Weaponize it. Yeah.
And so I tell them, go to a counselor.
Yeah.
And it's amazing how you
Or
all
your
do your
family
notes.
doctor.
I love it. Or your or even, and I'll tell women, go to your OBGYN.
Yes,
Like,
100%.
no one's going to think of checking your OBGYN records.
Yeah, exactly.
But you
Now
it's
everybody will because
It's still protected.
the whole 4 people that are watching it.
It's still protected. It's still HIPAA. Yeah.
it's HIPAA protected.
But I
And
tell them
double for
also-
mental health. Yeah.
I tell them also, your LPC is not going to write down.
No.
She said this. She said this.
Absolutely no.
Like, no, you all
No.
no, like, it's amazing. So
Yeah.
even if somehow they get your records, there's not going to be stuff in there to
No.
use as ammo.
No.
But you all have such memories that you know when your patient comes in, you know, what you wrote on there that prompts you, remind you. What
That's
your-
exactly how I work. I will use certain
Yeah.
verbiage so that I will remember this is what we were discussing and stuff like that. That's exactly
Yes.
how I do it.
I just want to
Yeah.
tell people it's not going to necessarily show everything that you're feeling or saying or
Yeah. And don't and so the original you said, does it go away?
yeah.
Okay.
Oh, sorry. Like certain diagnoses.
Okay,
I've heard
so
the bipolar,
anxiety and
the
depression,
schizophrenia.
think of it on a spectrum mild to severe, and it'll go from severe during certain times. If you're getting a divorce, if you're thinking of separating from your husband, it might go moderate to severe, and other life transitions might be going on, and it spikes, right? And maybe sometimes it's not related to anything that's happening. Maybe it's just physiological, it's happening, and you have a history of anxiety and you're spiking for no reason for a 2-week period. An intervention's warranted at that point.
Okay.
But not always, and we don't know what the intervention could be. The gold standard is medicine and therapy for 6 months to a year.
Okay.
But not everybody can tolerate that. Some people would rather take a pill and would never think of talking about what's going on, right? And other people would not want to take medicine and they'd rather sit and talk, right? So it's either or both together that is ideal for the best results, right? Is both together.
And I said that was the last one, but it's not. I thought of one more when you were talking.
But regarding the bipolar diagnoses, if you have it at one point without intervention, without medicine, right? It will progress.
Right?
It progresses.
Okay, that's what I always assumed.
Yeah.
Right. We have that diagnosis, and
That
what
was
I
different.
what I tell my clients all the time, I said, my job is to make you feel comfortable to where you don't have to come back to see me.
Yeah.
Like, I'll see them every week and then I stretch them every other week. And so once we're comfortable, it's like a mommy saying bye-bye to the birdies. And they know if at any point they feel this anxiousness or they feel this depression coming on, I'm a phone call away and we just start up again. So if I'm doing my job,
Yeah, your point isn't to have them
my
as
point is
perpetual
not to
client.
have them for 6 years. I'm always going to be there for them, but my job is to teach them the coping skills they need to get through what they're going through.
So the last one, I promise, alcohol.
Yeah.
So it's good and it's bad and it's everything, right? Yeah. So I have it seems like more alcoholic women recently than alcoholic men. Do you all see that as well?
I have seen that trend. I have seen that trend.
And no, not you. Okay, good.
Alternative
Okay.
gummies, CBD, THC also use, I think, has increased.
Okay.
Yeah.
And then what about alcohol in the age group we're talking about, like 12 to 18, 12 to 20? Well, I guess 18.
So alcohol is definitely being used, but the bigger concern is that it's binge type drinking. It's not even just binge type drinking, it's high intensity drinking, which is large amounts of alcohol for longer periods of time. A binge episode is 4 drinks, clinically diagnosed, in 2 hours. So that's kind of normal. You think like, oh, everybody, what do you mean? I have a shot, I have a couple of beers.
Yeah, we can have that.
That's a binge episode. So kids are engaging in that type of drinking, and that's more concerning because that correlates with more problems. Obviously, blacking out, alcohol use disorder in the long term. So what I'm seeing is also very high functioning teens in the best schools here. Yes. When they drink, they engage in binge drinking type and high frequency drinking type behavior.
So recently someone told me, I've always thought of binge drinking as like you said, you sit there and you have, I'm gonna make it up, 8 drinks in one night or, whatever.
That's high frequency. That's high intensity. That's
High intensity.
And then I'm being told, no, binge drinking can be, they said 3 different things. One of them is like you binge drink is like you do it every weekend, and that's considered.
Sure.
Or was it? No, it was the word alcoholic, not binge drinking. So you can be classified as an alcoholic, and there's different things, not just I drink.
Right. Your faces.
100%. An alcohol use disorder is not just daily drinking.
Yes.
Yes, it can also be binge type.
That was eye-opening to me.
And alcohol use disorder can be diagnosed with binge type drinking. Correct.
And
usually, don't you hear that people are like, I don't have a drinking problem.
Yes.
I can go 2 weeks. I didn't drink for 2 weeks, but then when you drink, you had 18.
You had to drink.
And you blacked out and you crashed your car.
You had to drink so much
but
to
I don't
get
have
to
a
that
problem.
level.
I have a problem.
But you had to that level, and then they pass out. So yeah, you have a problem. You have a problem.
And so,
Everybody gets really quiet.
Yes, because most of us have drink. There's a lot of people that are
There's social drinking.
fortunate enough that
right.
that have it.
Yes.
But then that leads to so then I don't want to say the stigma. So you're an alcoholic per se, and someone calls you out on it, and they use it in the divorce. If you're treating somebody for alcohol, you said abuse?
Alcohol use disorder.
AUD. Alcohol use disorder.
Yeah.
Do you do it with medication, or do you do it just with the therapy, the counseling?
Oh my gosh.
That's hard.
Because those medicines are scary.
Listen, AUD plus a mental health condition, that's we call it a dual diagnosis. It is the stickiest.
Oh.
It's hard. They're separate things. An alcohol use disorder or substance use disorder needs to be treated inpatient usually.
Separate and apart.
Yeah.
That's where you get into psychiatrists and stuff like that.
And it requires an inpatient intervention.
Okay.
And as far when someone's coming in and they have anxiety and depression, and that's my specialty, that's my jam, let's work on it. But they're drinking 2 bottles or a bottle and a half and high functioning, and they don't see the connection. That when they wake up in the morning and the central nervous system depression is gone, the alcohol's gone, their anxiety spikes and they're like, I'm just anxious. I don't know why. I'm like, well, you drink a lot. And now
That is why.
Now it's
That's
gone.
why.
And now you're super anxious. It's really hard because they don't want to hear it. Yeah.
So it's like she said in the beginning, we refer out to psychologists for assessments a lot, to psychiatrists when it has to do with medication. But in reality, they refer to us for all the counseling.
Yeah.
So it's like a little circle. We all help each other out. And we refer out when we think there's medication needs to be done or an assessment in order to get the medication to the correct people. And, most psychiatrists are not going to say, okay, well, I'm going to counsel you for 45 minutes. They've got so much other stuff to do. They will refer them to us and we'll do the counseling. At least that's how it's been with me and the people I refer to.
And if someone has an alcohol use disorder or substance use disorder, you can't tell them you need to quit.
Yeah.
Because they're not going to listen.
That's not how it works.
But you can use motivational interviewing. You ask them, why are you thinking about this? What's been going on in your life? What consequences are you seeing? And there's 2 paths. There's reduce or cold turkey. And the choice is theirs. And you can give your recommendation, and you can say, look, statistically likely, if you continue down this path, these are the health conditions you'll have. As far as anxiety and depression, it exacerbates it.
It's worse.
Yeah, but I can't be a sober companion and make someone quit, so it can be something you bring up and you ask and whatever they want to do. And if they don't want to quit,
Really suggest.
and if they don't want to quit, I keep seeing them, but we have to manage expectations as to the progression of their anxiety and depression, which is my specialty. Does that make sense?
Yeah, no, it does.
So that's how I handle, I don't know how you handle alcohol use disorder.
That's exactly how I do it. And they always ask, well, what should I do?
Do you think I should quit drinking?
What should I should do? And I always say, honey, this is your decision.
Yeah.
I am going to back you on either way, and I'm going to try my best to get you through this. But ultimately, the decision is yours.
And what impact will it have in your life if
That's
you
right. And
if
your
you
family.
reduce?
That's right. Everything.
If you reduce or discontinue. And medically, there are supports as well.
Yeah.
There's medications that can help people. If someone is a really high intensity drinker, they will need some management.
So
Some benzos or something to help manage until they quit.
you were saying, Rena, that, you all work in conjunction with the psychiatrist as needed.
For sure.
If someone wants to reach out to you, they see this today and they're like, my child needs some help. How do they find you? Because it's not that easy to find you. And you too, Christy. So if someone's looking for you, how do they find you, Rita? Is there a phone number, an office?
I do
What would be
have
the
an
best?
office. I've never Googled myself. I'm not even sure because I do not advertise. We're
telling you,
licensed. I mean, we're licensed. They can
Yeah.
go through the Texas,
Okay.
But yes, I mean, I do have an office here in McAllen on McCall. I mean, my phone number is 956-664-0003. I had to think about it. But
So,
yes, we both have smaller practices.
Yeah, that's why I'm
Well,
saying.
you can find me. I'm actually, I think, a pretty findable.
Got it.
So if you Google Counselor McAllen, Counselor Edinburgh,
We should come up.
Counselor,
You don't. You
my
might
website
now,
is
but-
top.
Okay,
My
good.
website's top.
And
So
what is it?
it's Counselor Christy.
Counselor
And if you just look up Counselor McAllen, Counselor Edinburgh, it'll come up.
Okay.
Yeah.
And I do
And-
not.
I know you
do
don't.
any of that.
Well, the only reason I have that is that John optimized my page, so it comes up top. And it's not that old; it's only been up for like 3-4 years. but
Okay,
yeah.
no wonder.
And then Psychology Today is a directory. You can also find me there. I have referrals, and if you go to your doctor, a lot of doctors here do refer to me.
Perfect.
Yeah.
Thank you,
So,
thank you, ladies, for taking
Thank you,
time out.
Lucy. This
I know
was
it's
so
like
fun.
crazy
I know.
time.
This is
That's
like
fun.
an adult play date.
I know,
I
right?
feel so grown up, like an adult play date that's
I
like
agree.
with
Thank you.
help.
Thank you.
Thank
ladies.
you.
We're done.
Sorry. Can I